Hi guys. Here to talk to you today a little bit about my surgery that I had done 2 weeks ago. I had two herniated discs in my back, my L4 and L5, L5S1 region in my lower lumbar. Um, don't know how it happened. Don't know how it started. I lifted a laundry basket, I guess the wrong way, but I think it started progressing a little bit before that. I would lay on my side and my foot would start feeling tingly for no reason, just little things like that. Lifted a basket, got wicked bad pain down my right leg. It started in. Thought it would go away. Didn't really go away. I woke up the next day and couldn't get out of bed. It was so bad. Talked to my doctor. Doctor said, "Oh, ibuprofen, you know, relax it, heat, cold compressions, did all that. It was just getting worse and worse. Asked her if, you know, she could do something about it because I knew something was wrong, seriously wrong. She said that my insurance wouldn't cover it, any MRIs or X-rays to be done until I had at least one physical therapy. Go United. So I went to physical therapy for 3 months. Did all these exercises, stretches, and again, it was in my right leg. It was just, sciatica pain. And did my 3 months of physical therapy. It really started to feel like it was gonna work. You know, a week before it was time for me to stop my physical therapy, was completely okay in my right leg, but started to feel a little funny, little sciatica pain in my left leg. And it got so bad to the point in my left leg where my whole left leg from like 2 inches from the bottom of my butt cheek all the way down the back of my leg, all the way down to my heel, into the left part of my foot, and 3 of my toes were all numb, completely numb. I couldn't feel it. Like I could feel like the inside muscles. You know what I mean? That something was touching me, but my skin was just completely numb. Like if like your foot had fallen asleep, something. Um, Pain worse than ever, way worse than it was in my right leg. Um, I couldn't sit for too long, couldn't stand for too long, couldn't lay down for too long. The doctor was giving me, my regular primary doctor now. She had to Google my symptoms. She didn't even know what the hell was going on with me. Um, she, giving me medication. I was popping them like fucking peg candy. Nothing was working. Couldn't take the pain away. The only thing that I noticed did relieve it a little bit was to lay on my stomach on the floor. I don't know what that did, but whatever. Long story short, I know you guys are probably wanting to get to the whole surgery part of that, and trust me, I will definitely get into that. Um, so had my MRI done, had my X-rays done, and got sent over to a neurologist. I guess it's like a back specialist, whatever. And hey, found out I had two herniated discs. And to my understanding, there are 3 types of levels of this herniation. I can't even say it right, but you guys know what I'm talking about. I guess the first one just a bulge. It can pop back into place. The second one is it's bulging out a little bit more, and the third one is just it's completely popped out of place where it's pushing on nerves, I guess, in the back of your spine. And I don't know if you guys know too much about herniated discs, but I guess there's 2 bones in your spine goes down, and you have a right side and a left side, which I didn't really know. Maybe I should have finished school. But the right side, the left side, my problems, okay, were in my left, so it goes down by some kind of funky numbers, L4, L5, S1. That's like the lower lumbar, and Anyways, you got these two bones, and then there's like a sponge kind of like material in between those bones. And what's happening is, I don't even know. I can like show you, but all right, here's your two discs on top of each other. The foamy, spongy part is like over here, and it pushed out this way up against nerves, and that's what caused that crazy sciatica, numbness, all that crap down your legs and into the lower part of your back. And so when I saw the neurologist, she told me that I had two of those discs. One being my L4, L5 was the middle one, the moderate one, and my L5S1 was extreme. That's what was causing all of that numbness in my leg. She was concerned about that because I also, with this, I guess the nerves, each one of those nerves break off into other nerves that control different things in your body. And this disc in particular was pushing on nerves that was in, of course, that left side of my leg, but also connects to your bladder. And what it was doing was, if it gets too bad, or if you have some sort of disease, you can piss on yourself. It makes you have like bladder problems, and I wasn't pissing myself, but I did have to frequently use the bathroom. Like, I'd go to the bathroom before I left my house, and me and my husband would go to Walmart, and I'd literally need to use the bathroom again. So it was definitely becoming a big problem in my life. But she said that I had two choices. One of them was to have some kind of cortisone shot, and what that is going to do is they're going to stick these needles, into your spine, and it's going to shoot some shit into your back, and it's going to numb, it's going to numb your nerves to relieve some of, or if not all, that, pain. And I don't know about numbness, but the pain at least anyway. Uh, this is something that it's not going to fix your back, but if you're scared about the surgery, which I definitely was, then it's something that you can look into. But I did do shit tons of research, and everybody's like, oh yeah, it worked for me, and other people are like, no, don't do it. It hurts like hell to get it done. Sometimes it don't even work. And one guy, he even got it done, and it made his symptoms worse, because when they shoot the shit into your spine, it made it more compact, in his back. So it actually did more bad than it did good. And it's not FDA approved. And I'm not really, I'll do tattoos, but I have kids, and I've done the whole, spine, needle back thing, and I'm not really for it. So my second option, she said, was surgery. And she said the type of surgery that I was going to be needing, and please bear with me because I cannot say this for shit, microdiscectomy. That's as close as it's going to get, because I don't know how to say it. But what they do is they make an incision an inch long, literally, like my incision's like, yeah, about that long, in your back. Of course, you're asleep for this. And they cut through the little muscle there in your back, and when they finally get to your spine, they have to chisel away a little bit of whatever bone fragment is there to be able to get to where your nerves and where the herniated discs are. And I've watched some videos, pretty gruesome shit, the way that they do it, but it's kind of interesting. They kind of suck the flesh away, and you can see the nerve, and when it's pinched, this like weird foamy shit, when they move, they push the nerve down, and then they get that whatever it is, disc that's popping out of your spine, and they pull it out, and it relieves the pressure and, you know, all the compaction on the nerve. So it lets up all that numbness and sciatica pain that feels like fucking back labor if you've ever gone through that. That's what it feels like. So I guess they you know they close you up and you're supposed to be okay. My symptoms with my sciatica, it's been a year actually that I dealt with it, and it just got worse and worse. And I didn't know what to do. You know, I didn't know if I wanted to do the surgery. I didn't know if I wanted to try these shots. You know, I'm 30 years old, never had a fucking problem in my life, and now all of a sudden, you know, I could be having back surgery, and you know, it's a decision that only you can make for yourself. It's a very scary one. It is a big one. You know, one false little move and that's it. You're done. You're fucking paralyzed for life. You know, so it's scary. But they could also do that with injections too. It's very, very literally paper thin, like little section that if the needle goes in too far, it could, you know, Google it, YouTube it. You'll see the videos of things gone wrong. I know I did. But you know, you're gonna have people say, you know, oh, you know, people saying, oh, you know, you're young, you know, you shouldn't be living in pain, you know, do what your neurologist suggests that you do. And she suggested the surgery because I'm young and I can heal quicker and all that. So I did take it into consideration, and then people are like, you know, oh, don't do it. You know, I've had back surgery done before, and you know, it didn't help with anything. You know, you're gonna have a big nasty scar. You're gonna live in pain for the rest of your life. You know, I wish I hadn't done it. So it's kind of like devils and angels, and kind of a bad thing when you become an adult. You have to make, you know, big girl decisions all by yourself. Kind of wanted somebody to say, you know what, this is what you need to do. It's the best thing for you. Go ahead and do it, and everything's gonna be fine. But it doesn't always happen that way. So I couldn't live with the pain anymore. It just got so bad to the point where I was just almost like, you know what, fuck it. Like I can't live with this pain. I just want it fixed. I want it done. I want it over with. I don't want to deal with this shit no more. You know, it was literally sucking away my life. You know, I couldn't walk my dog. I couldn't wash a dish. You know, I stand up for 10 minutes and I would have to sit down and just to relieve the pain, and then only be able to do that for 10 minutes because it would act up and I have to stand back up again. No matter what I did, it just fucking sucked. Um, my poor husband, he works 6 days a week and he would have to come home and clean the house. Like, shit. But I said, fuck it. I was going to do the surgery. I scheduled it that day with her. I saw my neurologist is Dr. Luciano Elmo from West Bay Orthopedics and Surgery in Warwick. Um, so that was it. It's funny because they gave me instructions. You have to fast 12 o'clock a.m. on, not 12 o'clock. It's not a 24-hour thing. Nothing after 12 o'clock. My surgery was set for 8:30 in the morning. I could have whatever I wanted up until 12 o'clock that morning. So they gave me a bottle of some kind of antibacterial soap to, wash up with 2 days before my surgery and either morning of or night of. I did night of. Because you can't shower and wash up and shit right after your surgery. So, it's kind of a good idea to kind of either do it, that night or if you can sleep that morning. All that night, it was the worst that it had ever been ever in my life. It was almost like my body knew that I was going to have the surgery. I couldn't even sit. I couldn't even lay on the floor on my stomach. It was still bothering me, and I literally watched the clock secondhand all night because it just hurt that bad. I was up and down on bed. I couldn't sleep. I couldn't eat, and even like the medication, I couldn't take anything. She said that if I needed to and it was bad, that I could just take, one pill with like a small sip of water, but the pills didn't really work anyway, so why was I going to bother? Whatever. Got up, got there, checked in. They got me in the back fairly quickly. My surgery was at Kent Hospital in Warwick, Rhode Island. So now I got my Johnny on, and they come in and they do the IV thing, and that's a different story. But some people know how to do it, some people don't. Some people bruise the shit out of you, and others don't. So they do that, and like I said, my surgery was supposed to be for like 9 o'clock. I didn't even get seen until fucking 1:30, and I was just laying there, just crying, screaming in pain. I didn't know that they could give me pain medication. They said I couldn't take anything for it. And the nurse walked by, and she was like, "Oh, honey, you're not good." She was like, "You don't need to be scared." I was like, "I'm not scared. I'm in pain." She's like, "Oh, do you want some medication?" I was like, "Shit, I would have known that. I would have asked you for it like before I even walked in the door." But yeah, don't know what the fuck it was, but I was laying there, and I can remember it was like squares on the ceilings, and it had like dots in them, and the fucking dots started to like move. So I was like, "Oh, okay." But 15, 20 minutes later, the pain was right back. So, anyways, um, yep. So finally, yippee, they come down and they're talking. I don't really remember what they were talking about. The guy shot some shit in my IV, and I remember looking away, and I woke up in recovery. Usually, they bring you to, the surgery area first. I don't know if it was just because I was in so much pain that they would just like fuck it and knock me out there, or what. But I woke up in recovery, and the first thing that I did was moved all my fingers. I'm touching everything, and I'm making sure I can move my fucking legs and I can talk and all of that. And I was good. And my throat was sore. They do when you have your surgery, they do stick a long, very long fucking tube down your throat. For emergency purposes, I guess. So your throat is going to be sore. Do ask. After your surgery, they will give you them funny little popsicle sticks with a little squeegee thing to like suck on water. I guess I had already asked her, the nurse for some, and I had fallen asleep with one in my mouth, but I don't remember that. And when I woke up, I first thing I did was I tapped, my left toes up against the bar rail, and I could feel it. I could feel, you know what I mean, like my toes. And so I looked at the nurse, and I was like, I can feel my toes. And she said, "Oh, that's good." And so I took my hand and I ran it down the back of my left leg, and all my feeling was back. There was no pain, no nothing. I was like, I can feel my leg. I was excited. This bitch is looking at me like I'm crazy, but I hadn't felt my leg in almost a fucking year. You know what I mean? So I was like excited. And she was like, "Well, that's a good thing." I was like, "Yeah, no kidding." And she wheeled me down to the same room I was actually in. I was in recovery for like maybe 45 minutes, I'd say, but I was awake anyway. I don't know how long it actually had me there. I was scared to death to sit up. But I sat right up like nothing, and I stood up. I stood up like nothing ever happened. I had no pain. I had no, even with wherever my incision was at that point, I didn't feel anything. But I was scared because I was doped the hell up, so of course I wasn't gonna feel anything. They brought me downstairs. I talked with the lady. She said that I looked great. She called my husband and said that I was ready to go home. I was like, all right. So now I'm trying to put my shirt on, and she's like, all right, yep, your husband's on his way. I'm like, all right, well, cut the shit off me. Like, I want to go home. And that was it. I went home that day. I had no pain. I had no numbness. I had no nothing. Big talk about incision for a second. Big maxi pad, thick, very thick. You know what I mean? And the lower part of your back. I did sleep with it that night on. It was very uncomfortable. Not that my incision hurt, but it was the pressure. You know what I mean? Pushing on it, laying on my back. Um, the next day, I did go to CVS and I did get, some more gauze, and I did take that big pad off and cut down to like maybe even like half the size of what it was. They do suggest that you keep the pad on the cotton on for at least 3 days. Um, I, obviously I saw it, when I took it off, but there was three very thin pieces of tape, like, over the actual incision. So I didn't take that off. I just, did the bandage thing. Um, Taking the tape off, that's probably been the most painful experience that I've had with this whole thing. That shit will rip your skin off. Be very careful when you take that shit off. I'm just saying. Um, Walking around the next day and stuff. They say that you can't be in a car. Definitely on the way home. I could feel, like things were kind of moving. I think around in the spinal area. So I was like, oh no. Went home. I took it easy. Um, Still no pain, no numbness. I could feel that, things, I had just had surgery. My incision was, I felt it. It didn't hurt, but it was different, and um, I did not want to wait 3 days to wash up. So I did kind of do like a half bend, with my leg up, over my sink with a spray to like wash my hair. And I did stand in my shower, and I do have one of those, detachable like shower head things. So I washed into my arms, and I didn't do my back at all. I made sure my hair was already dry before I had done all that. And I was good. I've it's been 2 weeks. I've had no problems. My incision's healing wonderfully. I've had no numbness. Um, Pain medication. Um, I took it the way that they told me to take it for the first 3 days. After that, I just kind of take it, if I'm hurting. Be careful. It will make you constipated. They normally don't tell you that, but ask for some kind of stool softener or something, because I was backed up for like almost a week. I had to take 3 of my stool softeners actually, and that's how I had to go to the bathroom. And after that, I was just like, no, no fucking way. I'm not in pain. I'm not hurting. So I'm not taking this fucking medication. Um, Something for inflammation, and then like the oxycodone or whatever. Be careful, that shit's very addicting. I mean, I'm not like a pill popper, but I've heard, but things, can get ugly taking that shit. So, I personally don't like taking any medication. I want my body to heal on its own, and if I'm doped up all the time, I can't feel what my body can do. You know what I mean? Like, for some reason, past few days, like I said, it's been 2 weeks. My muscles and my back have been bothering me. Like right above my ass, like, and in between the incision, the bottom of the incision in my butt. But then I went to my 2 week yesterday, and she said that everything was good, and that was actually normal. Um, my muscles are healing. She wanted me to start my physical therapy, which I've already made appointments for, but I don't know. What else to talk about as far as anything else? Do not bend. Do not bend your lower back whatsoever. I don't care if you think that you can do it or not. I'm scared actually to even try to bend. I will never lift a laundry basket, even if I have muscles in my back. I will never do it again. Never. I'm afraid that, with the things still healing, that if I keep bending, it's gonna keep wanting to push the rest of that disc out. And I don't, not that it wasn't Not that it was a horrible experience, but I really don't want to keep having back surgeries for the rest of my life. Like, comment, share, ask questions, please. I will give you all the information that you need. My advice, I'm happy that I did it. Do it. It's scary. I know. Now I can walk my dog. I can swim. I can wash a dish. I can, nothing. There's been no problems since then. So if you do have herniated discs and you're watching this video because you don't know what you should do, surgery today is so much different than it was even 3 to 5 years ago. It's the technology that they do now. I mean, they don't even need to cut you open all the way like they used to back in the day. They take like a little tube, literally like that big, and they put it in your back, and they have like a microscope. You know what I mean? They can just see. You know what I mean? It's just amazing. So yeah, that's my experience with the L5S1 um microdiscectomy or whatever the hell it is. I hope this video answers some questions for some of you. I know that it did help me a great deal, and like I said, like, comment, ask questions. I will try to help best I can. So good luck.